So hello everyone. So I am Sridharan, Assistant Professor from SNS College of Physiotherapy. So in this video we are going to see the joint mobilization. So generally the joint mobilizations were done on particularly on the synovial joints. So now we are going to see the joint mobilization in this shoulder joint. So basically shoulder joint consists of 6 major movements. So they are flexion, extension, internal rotation, external rotation, abduction and adduction, along with the all plane movements, which is known as circumduction. So if a patient's shoulder joint is compressed into an periarthritis shoulder, which means no movement. So if the patient have a no movement in the shoulder, but we have to improve the flexion in their joint, so first we have to glide their movement so to the opposite side of the plane. For example, if we want to improve the flexion of the shoulder joint, we have to glide their joint into an posterior side. So in this video we are going to teach the joint mobilization for the students. Now generally for the joint mobilization there is two holes, which one is proximal and second one is distal. So first the patient should be in the supine lying position, as the joint should be away from the couch. So the patient should be in the supine lying position and the joint should be at the edge of the couch, and the therapist should be in the walk standing position. So the proximal grasp should be at the elbow joint, and while grasping the elbow joint by using same hand, we have to apply mild traction to make a joint distraction. So while making shoulder joint distraction, it helps in creating the space between the head of humerus and as well as also the glenoid cavity of scapula. So placing hand like this and grasping the elbow joint, we have to apply mild distraction at the shoulder joint, and the left hand should be at the places on the head of the humerus. So now we are going to glide the shoulder joint into an inferior downward side. So placing hand like this and proximal grasp should be at the elbow joint, applying mild traction, and we have to apply glide as an inferior side like this. So like this we are applying the distraction and also an gliding to the inferior side. We are going to improve the flexion range of motion in the patient. So if we have to increase and range of motion to the shoulder joint for improving shoulder extension, for this the patient should be in the prone lying position. Prone lying. So prone lying is nothing but as the patient should be lying in their tummy side. Okay, so like same for increasing the shoulder extension range of motion. So same, patient should be in prone position, therapist should be in walk standing position, and the therapist grasp should be around the mid of the humerus, and as patient should lie to the edge of the couch. So at the edge of couch position, hand should be at the mid of humerus, and the proximal hand should be placed at the greater trochanter of the humerus. So while applying traction, so at the same time we have to apply glide to the anterior side of body. So while applying the traction to the anterior side of the body, we are going to improve the extension range of motion in the patient. So first we have to apply the traction, and then we have to apply anterior glide to the shoulder joint. Okay, thank you. So first, while applying the posterior glide, so we are going to improve the flexion range of motion, and as well as while applying the posterior glide, we are going to increase the extension range of motion. For increasing the abduction and the adduction of the shoulder joint, we have to apply the superior glide or an inferior glide for the increasing the abduction and adduction range of motion. First, we are going to improve the patient's abduction range of motion. Abduction is now nothing but the hand should be moving away to the body. This is known as abduction, and while hand is moving towards the body, it is known as adduction. So these are some of the mobilizations we have seen in this video. There are some other mobilizations were also applied for the shoulder joint. Those mobilizations we are going to see in the next video. Thank you.